Welcome. My name is Dr. Russ Kort. I'm a chiropractic physician, lead physician of Dr. EMF, and I'm here with Joanette Biebesheimer, love of my life and chief scientist of Dr. EMF. Tonight we have a very special webinar for you with a very, very dear friend of mine who is a hero to me and to many others. Shall we get started?
But before we do, why don't you go ahead and do the disclaimer?
I'll just do the disclaimer. These statements that we're going to speak of tonight and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address our deficiencies and provide the nutrients we are lacking. Nothing said here today is intended to be a substitute for treatment or any appointment with your primary healthcare provider.
Excellent. Well, why don't we go ahead and introduce and go over Dr. Prasad's accolades, Dr. Kort. And welcome, Dr. Prasad. We're going to pull up your accolades real quick. So we have a lot of people that are brand new here on this call that would like to know a little bit more about you. So Dr. Kort, would you mind doing that?
I'd love to. Dr. Prasad was a professor at the University of Colorado School of Medicine in Denver for more than 30 years. He was the director of vitamin and cancer research. He is also the former president of the International Society of Cancer and Nutrition.
Hang on, from 1992 to the year 2000.
I love that. He was a member of the British Society of Medicine, London. He was also asked to sit on the Nobel Prize nominating committee for candidates in medicine. He is the first radiological PhD radiological biologist in the world. I like to throw in it was a 7.5-year program, and he finished it in 3. He also has been awarded 7 U.S. patents on micronutrients. Discovered the anti-cancer potency of vitamin E succinate. He also discovered butyric acid and that it is also an anti-cancer agent. He is the author and co-author of more than 32 textbooks. His last one published was on dementia and memory loss, and he has also published more than 250 peer-reviewed articles.
In very prestigious journals such as Nature and Science.
And if you look him up on PubMed, he's listed more than 450 times.
So welcome, Dr. Prasad.
Welcome, Dr. Prasad.
Thank you, Dr. Kort. It's always my pleasure to be with you and your group.
We love seeing you. Go ahead, Jet.
Well, tonight's call is the Optimal Longevity Series. So if you've not been here, welcome. And I want to pull up the reason why we're here, and we're going to go over this graphic real quick. And let me see. Your lifespan is how long you live. Your health span is how many years you live a healthy, vibrant life. And we want your health span to equal your lifespan. And right now in the US and across the globe, normal aging, you can see on the very first part of the slide, people are not enjoying in their later years. They have a lot of diseases and really not enjoying that. But we know that you can live an optimal, healthy life with Dr. Prasad's, not only his research, his patents, his products, his life's work. And so tonight, we're so excited to be able to kick off the Optimal Longevity Series with a very, very good friend of ours. But before we do, we wanted to start with this message from Dr. Prasad to segue in. I think it'll be good.
Roll that wonderful bean footage.
Okay.
Hello, my friend. I'm Dr. Kedar Prasad. During my career as a radiation biologist at the prestigious Brookhaven National Laboratory in Long Island, New York, I became convinced that the right combination of vitamin and micronutrient could result in a groundbreaking formulation that could fight oxidative stress and inflammation. As many know, those are the sources of most chronic diseases. Not long after this, I became the chief scientist and formulator of that groundbreaking micronutrient formulation. Today, that formulation is known as MicroDaily. Once MicroDaily was developed, it became clear that this formulation could potentially assist military personnel who suffered from the toxic effect of war. With a $24 million grant funded by the Department of Defense and private investor, I led the research team that validated MicroDaily's efficacy. The benefits of MicroDaily have proven to be much more than I originally thought possible. Through MicroDaily's CQF standard, which stands for combination, quantity, and form, the right combination of antioxidant micronutrient in the proper quantity using the specific natural biological form helps to support the body's ability to unlock its full potential by maximizing absorption and delivering maximum results. MicroDaily is the formula that is most near and dear to my heart, and it presents an achievement I hope will ultimately benefit all mankind. For this reason, I joined Engage Global as their Chief Scientific Officer. Knowing David Nemelka to be an honest and sincere individual, I knew he would help to get my formula into the lives of as many people as possible. It has been an honor to hear from so many who have benefited from this formula, and I look forward to hearing your success story. Thank you very much.
Wow.
Well, you know, you're on with this live, Dr. Prasad, but when I was watching that footage, I thought, this is why we do these calls. And so tonight's story, because you want to hear these, is from a really good friend of ours. But Russ, why don't you go ahead and talk a little bit about our special guest, and then we'll bring him on.
Well, our special guest tonight is Dr. Joe Schnider, and he is a functional neurologist and a chiropractor, and he is a hero of mine. Dr. Joe and I have known each other for over 13 years. We met at a conference in functional neurology, and it was just like I had met a brother from a different mother, and we have been dear friends. And Joe's going to share a very personal story with you. You know, so often we hear of all these different disorders, people with diabetes and heart disease and stroke, and, you know, the myriad of health concerns caused by oxidative stress and inflammation. But it's not until one of your dearest friends calls you and said, I've had a stroke and I'm in really bad shape, that it touches your heart and soul. And so with that, go ahead.
Bless you, Dr. Prasad. I want you to know, but before the stroke, that Dr. Joe Schnider had many clinics, that he was best in world in brain rehabilitation with extremely complex cases. So prior to this stroke, he was very distinguished. Okay. And so when Dr. Kort got this phone call, it really, there aren't any words that describe that kind of phone call. So with that, we're going to go ahead and bring Dr. Schnider on.
Our stroke survivor and thriver. Welcome, Joe Schnider. So great to see you, Doc.
Great to see you all. I'm really honored that you asked me to be on this call. And I'm honored to be on with Dr. Prasad, who's been my hero also for all these years. And Dr. Kort, yes, you have been a special friend, a special colleague, and a special professional that I've had many talks with over the years that have contributed to my success. So thank you.
Thank you, Joe.
So with that, I wanted to talk a little bit for people to understand what happened, like who he was before the stroke. And he had many clinics. And then the kind of stroke you had was a hemorrhagic stroke. Could you tell people on this call the different types of strokes? And
well, let's start with how he woke up.
Yeah.
And then his journey and the strokes.
Sure.
Is that okay?
Yes.
Okay, perfect.
Yes. Okay.
I didn't mean to put words in your mouth. Joe.
Go right ahead, Rob.
Yeah, Joe. Could you please tell us about that morning when you woke up, and then tell us about a little bit about your journey and the kind of stroke you had, because there's many different kinds of stroke, and you're a
Yes.
specialist in this.
Well, in 2004, I had an auto accident, and I got knocked out, hit my head on a windshield, and then I broke my hand, had a lot of issues with my brain and my body. But one of the things that I did have was an increase in blood pressure. I was an avid exerciser, runner, biker, swimmer. You know what it is that just drives you every day is get out there and move and enjoy nature. And so that caused me to have an increase in blood pressure. And I started getting under control after about 4 or 5 years. And then in 2013, I got rear-ended. It was a drunk driver, hit and run. And I started having more trouble with my blood pressure, balance issues, and all kinds of motion sickness. It was pretty complex. And I think in 2004, that's when my aneurysm formed. And then it popped on May 23rd, 2017. It was in my anterior cerebral artery, and it affected my subcortex called the basal ganglion and the thalamus. It was just a little bit away from my internal capsule. I was getting up every morning and doing CrossFit. So I got up that morning. I went into the bathroom and I came back out, I laid down. And then I felt like, I had a God moment. And I started talking to God. I said, if this death, that's not bad. There's no pain. I'm coming. I'm coming, Lord. And then I just snapped out of it. I totally woke up. And then I couldn't move the right side of my body. I was paralyzed completely on my right side. And I tried to get out of bed, and I fell on the floor, hit my head. And then I started joking with God again. I said, okay, God, I guess if nobody knows that I'm on the floor of my bedroom, then I'm going to die pretty soon. So I'm coming. All right. And I started just going through in my head everything that I was grateful for. And then my phone fell off my bed at that moment, right next to my left side of my head. I could get it with my left hand. And I was able to text my daughter, who was upstairs home from college, who probably wouldn't have gotten up till 2 o'clock in the afternoon. So they rushed me to the hospital, and I got to the hospital, and they got an IV in me, and then I started my road to recovery. And I went through a lot of anger and a lot of acceptance, and anger and acceptance, and I prayed a lot, and I got out of intensive care. And they took me down to rehab, and I had another stroke. So I had my second one. And then things got really funky with the way I felt and I was functioning. And I started giving up, totally giving up. I'm not a giver-upper. I'm usually let's get up and go. So I think they thought I needed the psychologist. So they brought me to the psychologist right away. And she gave me a book. It was called Grit. And she says, you got grit. So whatever it takes, you're going to do it, and you're going to make sure that you get back. And what do you want to do? I said, I want to treat brain injury cases. And that's what I want to do. So I lost everything. I lost my home. Just everything. I went $1 million in debt. And when I got home to my family, they were just like, okay, you're done. You're going to be disabled. The doctor said you'll probably be disabled. And a friend called me from New York and said, why don't you come up to my clinic and start rehabbing? And so I did. And I went to the clinic. I started fasting. I had already been taking the micro daily, and I continued to take it through my rehab. And after I got back after 2 weeks in New York, I knew that I was going to get better. And then I started talking to my wife about the fact that I wanted to start a brain clinic, and I wanted to call it Hope, the Hope Center, for people that didn't have any hope. So she thought I was nuts. She thought I was really crazy. She says, like, I have no clue how you're going to do that, right? But in September, I felt well enough to go back to work. So I got in my car, I drove to Springfield, and I begged everyone that I knew to let me use their offices, start practicing again. And then one of my friends, after I got many no's, said, of course. So on the mornings that he wasn't there, Friday afternoon, he wasn't there, and Saturday. So I worked 4 days a week. And I started getting patients back. Very tired, a lot of fatigue I had to work through. I couldn't walk down a hallway, like a narrow hallway. And he had a narrow hallway in the back of the building to get in. When you first came in, you parked in the back, you went through the hallway, and it gave me like total panic attack. And I made it through the first time, and I decided that I would walk all the way around the building and then go in the front door and never in the back door. And he asked me, he says, why don't you just come in the back door? It's so much easier. I said, well, not for me. I can't do it. I couldn't take things moving in my space. It would just make me dizzy. And so then it was time to like get an office, and my credit was not good. It was totally damaged. And I got no's. I got no's and no's and no's. And then I came to this building that we're in now, and they signed a lease for me. And they never checked my financials. And so I knew that God was there again, that God was pushing us forward. And so I scraped together whatever equipment I could. I took the space, and then in the lease, I said that in 18 months, I was going to expand from 2,500 square feet into 6,200 square feet. And again, my wife thought I was crazy, but you know, it's so funny. She just backed me through every step of the way. She did invest some of her own money, and it just started taking off. And then just before COVID hit, we got the expansion, and then we thought, okay, we got another big nut that wasn't going to happen. And so we just prayed, and then God was there for us, and it's a miracle that I have the center that I have. So I have 6,200 square feet of the most well-equipped center in the world. I don't think people can compete with me there. And I have experience, and I've treated many, many patients. So we developed a system of brain-specific rehabilitation using functional medicine, nutrition, and so forth. Our programs are expensive, they're comprehensive, but we're getting radically great results with it. I treat everything from autism, ADHD, violent kids, Parkinson's disease, a lot of Parkinson's, traumatic brain injury, stroke.
Professional football players, professional basketball, boxers.
Yeah, you know, I've done that too. But you know what? I mean, I really decided, and Dr. Yang, my wife, decided that that's not what we want to do. You mean like professionals are professionals, and in their own right, they've really have accomplished things that a very, very few people can accomplish. But then there's the football players that never make it, the football players that get injured along the way. And they have a myriad of problems, including traumatic brain injury, shoulder problems, bad knees, bad backs, bad necks. And so we knew that if we accepted these athletes that never really truly made it, that it would be very difficult to treat them without doing it comprehensively. So we won't take a case and do segmented care. You know, if a person wants to come in, get a chiropractic adjustment, a little therapy, and go home, doesn't happen. It's like, all right, we did the exam, we have all the diagnostics, this is what's going on. You either do it comprehensively and you don't do it at all. And so we stuck to our principles. And so by doing that, our outcomes are amazing. In 20 visits over 10 weeks or 24 visits over 12 weeks, we can do things that I thought was impossible before I had the stroke. So we're very high tech. You know, my background is I have a degree in engineering physics, and I was an engineer for 5 or 6 years before I went to chiropractic college. So technology is near and dear to my heart. We use harmonic vibration, sonics, which Dr. Kort turned me on to. And that's really an important part of our therapy. And we do combination therapies, interactive metronome, balance, vestibular therapy, laser, visual therapy, you name it. I don't think there's anything that we're missing at this point. And so we're really proud of the relationships we made with people. And so using nutrition has been important, but we made a dedicated decision over a week ago when the Micro Daily Hydro came out to be giving it to patients before they start their program. Now, this was Dr. Kort's idea, which is brilliant, really. And so we've been giving it to patients so that we're trying to plasticize the brain. So the brain needs to grow when it's shrunk, either from inflammation, from trauma, from autoimmune type inflammatory diseases, and so forth. But it needs support. And where it needs support is it needs the antioxidants, it needs the anti-inflammatory processes. And it also needs the mitochondria to function at the higher level and to multiply. And so if we're going to plasticize the brain, then we need to give it a nutritional foundation to hold it to a point where we can do more work, there won't be metabolic breakdown, and then we can actually get more plasticity or a regeneration of brain structures with the work that we do.
What products do you use, Joe, in your clinic? Did you want to ask that?
Go, it's okay.
Sorry.
Yeah.
So we're doing Micro Daily Hydro. We're doing Brain Boost. We're using the collagen, the CBD product, and the probiotic.
That's good.
So I want to say this. So for everybody on here, this was a big stroke. It is remarkable. It's a miracle.
It's a miracle.
It's a miracle.
It was a monster stroke. Joe kind of plays it down. And we had a lot of conversations about it, Joe, and I always told you that you could do it, but.
And he was on the Micro Daily product. And so I want to segue to Dr. Prasad here. This is a very big deal that Dr. Joe Schnider now has the Hope Brain and Body Recovery Center, and at the high level that he's doing after that kind of stroke. So Dr. Prasad, when I called you today, I wanted to, discuss that Dr. Schnider is going to be on, and his amazing story. I mean,
it is.
And,
but go ahead.
No, I just wanted to segue to that. And what are your thoughts about the stroke and about where he is now, and your opinion?
Yeah, I think it is very good that he had this experience. But I was looking into the hemorrhagic strokes, and it is amazing that I didn't realize that the secondary brain injury that follow, which creates all kind of secondary brain injury, is a is all mediated by a high level of oxidative stress. Free radicals are generated extensive amount, and of course they turn on the inflammation, then they feed each other. So the most important player in the progression of the disease after a stroke, we have a secondary and third, and prevent any regeneration possibility, because as you know that many people have identified that they have now stem cell neuron have. And so for that reason, and the reason microdaily was so effective, that it can reduce the oxidative stress and inflammation at the same time. And brain is the least efficient to fight against oxidative stress because they have lowest level of antioxidant in a normal situations. And when this have aggravated situation, it gets worse. So if you don't intervene earlier, then you suffer all this kind of disease, and sometimes people think it is irreversible. But in his case, it looks like that surprises me that he can recover fully and now doing his job that he loves to do it. And so I think it adds up extra information that even not immediately right after a stroke of any kind, same problem, intensity may differ, but the problem will be same: oxidative stress and inflammation. So not only if you take it right after it happens or a few days after it happens, it could recover much, much faster. But how long after you suffer that you have started microdaily, Dr. Schnider?
I had already been on microdaily.
When you suffered it?
When I suffered it, yeah.
Okay.
And I just keep taking it. Keep
taking it, okay. And then you did not have as much as problem. Recovery will be slow because it is not like medication that you have quick effect. But before you had a stroke, you were taking it, and you continued to take after a stroke, and then as a function of time, you recovered fully. Is that correct statement?
Well, I wouldn't say I recovered fully. I still have problems.
Well, I mean, at least recovering to a point that you are now functional.
But I think that the key part of it is that I had a scab in my brain, and I had the stroke May 23rd, and I had about a 2-inch scab in my brain from the blood.
Because of the injury that you suffer in the
September, when I re-MRI'd my brain, my scab was gone.
Mm-hmm.
So the aspect of autophagy, where the brain has the ability, where the microglia and the supportive cells, the glial cells, have a propensity to clean up the brain.
Mm-hmm.
So I had no scab in September when I re-MRI'd my brain.
That's awesome.
The neurologist was sitting there looking at it, and he said, "This is in your MRI. It can't be. I've never seen this before." And I had a completely clean MRI. My ventricles were larger because I lost the volume of my brain. But I had my tracts back, and I had no sign of the original injury itself very quickly.
Yes.
And that was, I think, really key to it. And then I continued to do my own neuro rehab in my clinic and at home. And so, I get better and better. Fatigue was my greatest enemy.
Fatigue.
And after 6 years, fatigue isn't my greatest enemy anymore.
So I want to ask this. So Dr. Schnider, you have the ability to use any product in the world to help your patients. Why have you chosen the microdaily EMF Hydro and the suite of products to help your patients? Because you can choose any product line.
Well, I'm not a mega doser. I get a lot of patients come in with 50 bottles of vitamins. They're taking like, vitamin C, vitamin E, they're taking all kinds of separate things. And they're convinced that they have to support their body. And it's just like they're drugs.
Yeah.
And the other thing is I read Dr. Prasad's books. And I really got into like really digesting the fact that the formulation and having nutrients work together synergistically to create antioxidant effects, which can affect the telomeres, can affect the DNA, the RNA, and the transport systems or the kinase systems within a cell itself.
Yes.
And it doesn't do it well when you overload a cell with all kinds of useless nutrients.
Exactly. That's why Dr. Kort and Joanette, we always recommend what is in the bottle preventive dose, which is sufficient. And the only place that is we make exception is when some people have a cancer. That is totally different beast. And but otherwise, for most of the place, people who are taking just preventive dose, they do extremely well.
Oh yeah, definitely. Well, when you give the body and cell exactly what it needs, and you don't beat it up with any formulation or treat nutrition as a drug, the body really does have a chance to go through the healing process.
Yes,
or
exactly.
To a point where they get better.
Yeah.
So, Dr. Joe, what's next for you? I know that you've got some big lectures coming up, and I know that you're going to be lecturing at Autism 1. And
Autism 1, September 3rd. Yes.
September 3rd. And what is your topic? What are you going to be lecturing on?
The functional neurological approach to autism to create plasticity.
Yeah, that's very autism. That's another thing that it is very important in case of autism. First, there are many cases that we know in our companies, consumers, whose children had autisms, and were doing very poor in the school. But once they were on a micro daily, at that time was just micro daily alone, not the micro daily EMF and brain boost and so on. Still by itself, the old formulation did a remarkable job to a point that the kids were started performing in a school well, and graduated with a very good record. And the reason is because some of the micronutrients that we have in our formulation not only reduces oxidative stress and inflammation, which are involved there, but also additional is that excessive release of glutamate, would also happen, by the way, in a stroke. Excessive release of glutamate, and some of the macronutrients that we have in our formulation have been shown to reduce the release of the glutamate. And not only that, but some micronutrient will also prevent the toxic effect of glutamate, because as you know, glutamate is very toxic to neuron. And so it has a double effect, not only reduce it, but also plus CBD is another one, which has also a role in preventing the release of the glutamate. But it cannot protect against the toxicity of glutamate. And so those kind of combinations, and so in case of autism, probably now, if somebody asks my opinion, I will say take, if there is children, that we have some children formula. But if you are the micro daily, either hydro or capsule, whatever preferred, and take a brain boost, and they also I would say the children also, if you're small children, I recommend probiotics because for one reason, because there have been cases that even people are, as you grow older, probably if he's a 5 to 12 years age, then probably you don't need a probiotics. But older than that, because intestinal dysbiosis has been linked to almost all human diseases. This is amazing. And therefore, but in that scenario, I think for the beginning, it is just try the micro daily EMF alone with brain boost, And if it is a little older kids, then we can try also one capsule a day probiotics. Same thing for ADHD too. Symptoms are very similar.
Yes.
And I think we had a question about the dosages for children. And I know that Dr. Prasad, if we could walk through, the gummies are made for ages, our children's gummy, which are an excellent product on this call, are for ages 2 to 5.
Yes.
Is that correct? Okay.
Yes.
And then
that is a preventive dose. But in case of disease, for example, in case of seizure, FDA has recommended to give a 750 milligram of CBD.
CBD.
So I think in the case of autisms, I think it is better to use hydro, at least half of the dose for sure, in terms of effectiveness, because this is not just preventive dose. People have already disease, and you have to make sure you provide sufficient amount of macronutrient, high amount, so that they can interfere with the release of the glutamate and also reduce oxidative stress inflammation. And so gummy bear is for kind of prevention of building up your immune system. But if you have some kind of disease, then you have to take it into consideration that the micro daily EMF hydro would be the best substitute.
Mm-hmm.
And the ages normally for 12 to 17 is
12 to 17 would be, right.
Half a dose.
Half a dose.
Awesome. So Dr. Joe, is there anything that, okay, so let's say, I'm going to tell this again. He had a couple car accidents. I didn't know that part of your story. So you had a couple accidents that were the precursors to the story. Very interesting. And then working out. And so you were a healthy guy doing a lot of activity. And then you had this, and then you had a lesion or a scab from where the brain bleed was, right? Where the
aneurysm,
aneurysm. And then how many months later the actual scab wasn't there?
3 months.
3 months.
Yes.
And so that is remarkable. And so then go ahead, Dr.
Remarkable because the antioxidant also induces a more efficient autophagy system. And the job of autophagy system is to bring all the dead particles and cell debris and everything to lysosome for degradation. And then it is removed, the cell then become healthy. So microdaily has very complex effect. It is not just the one effect. And the antioxidant and micronutrient has a very complex effect many times. It is nothing to do with free radicals and inflammation. It is totally independent. And for example, in case of, you remember we ran a clinical study in Denver with firefighter, but this was, they were given because they have a heart risk of heart disease, and Dr. Jeffrey Boone, who was a cardiologist for Bronco, and they found that the 1 year trial, 12-month trial, and he measured the parameters of lipid profile and the thickness of carotid artery, plaque formation. And in 6 months, he saw that there is a decrease in the plaque formation in a group that were taking a microdaily. But those who were on a Lipitor, for example, in this case was simvastatin, and they did not prevent the increase in the plaque size. And at the end of 1 year, the people who were getting a microdaily alone had no plaque in carotid artery, and who were taking a simvastatin or Lipitor, they had a plaque, just like a normal aging process, you will get it. So this is the first time that it is the tissue modification occurred because of the micronutrient, and whether it was related to oxidative stress, I don't know. But the fact that this happens, this shows you that it has a much more complex effect.
Yes.
So are you saying that they had 100% improvement in the plaque in their carotid artery?
Yes, no plaque formation. And he did it by measurement of plaque formation by ultrasound. and because he was himself a cardiologist and very good cardiologist, of course, of Bronco. And so I was very happy and surprised. I was, and lipid profile was as good as the Lipitor in terms of lipid improvement in lipid profile. And so he started calling micro daily as a poor man's Lipitor. And, these are some studies that you don't expect it.
Right. So as a peer of Dr. Joe Schnider, and a friend, colleague, is it not just miraculous the type of stroke he had and his recovery, and now actually pursuing his dream of having, a world-class brain rehabilitation clinic? I mean, how does that make you feel as a colleague?
Yeah, I mean, I congratulate first on your effort, persistence, and that you did not give up, like you said.
Thank you.
And keep doing it, and then you see the result. At least you are functional enough to help others as well.
Yeah.
What do you have for Dr. Prasad, Joe? Because we're just grateful to have you on this side of the dirt.
Yes.
Yeah, exactly. I'm not dirt yet.
No.
Well, you are young. I mean, I'm old.
How young are you, Joe?
I'm 65.
Well, look at that. He's a kid. He could be my son. I'm 88.
Oh, yeah, that's cool.
Joe, what questions do you have for Dr. Prasad tonight?
Well, I mean, I don't have questions for him. I basically have a lot more accolades than anything else. He's done the work that has formed my approach to patients, and I think that when I am working with patients and I'm able to use superior products and superior methods, that I get outstanding results with people that have given up hope. And that's why we call it the Hope Center. And it's really a privilege to be able to do this on a daily basis. So when I get in the morning, I have new cases that come in, they've gone everywhere, they're not getting any better. And to be able to give them back a life, have better outcomes, that their activities of daily living become more fruitful and joyful for them. It puts families together. And so you have to do that by working with good professionals. You can't do it alone, can't do it in a vacuum. And so having Dr. Prasad out there as this beacon of knowledge and information and assistance in the treatment of our patients is just a privilege to be working with such a great company that he founded.
That's great. I mean, and also that, anytime I hear a person like yourself and others, I'm sure you enjoy too. If you make 1% better for me, I feel happy, because my life still was making a 1% happier and than they were before. And so you are treating so many people, it makes you feel proud and happy that you have contributing to the society and to humankind, the best you can. And that's what the purpose of life, my life is, and I'm sure it is life of yours as well.
Yeah, I see that. The patients that come in, most of the patients that have reached a point where they've gone to every doctor and every doctor hasn't found a solution, they finally give up and say they're psychotic or they have a psychotropic issue, right?
Yeah.
And that it's really all made up. So these are the patients that we're getting, and to be able to find strategies in nutrition, functional medicine, functional neurology,
yes,
put it together, shows the body does have resiliency when you give it what it needs.
Yes, yeah, definitely.
And
Yeah.
one of the things that I wanted to say that for people on this call is that there are no medication contraindications. So when
Yes.
Dr. Joe has somebody come in, if they're a veteran, they could have a laundry list of different medications. And I know that for him personally, not having the medication contraindication from the research that Dr. Prasad has done is really, it makes our lives so much easier knowing that it's safe.
Yeah.
And that's just really, really important.
Very important. My first case today came in, he's on 15 medications.
Mm.
You don't even know what the interactions of the medications are. So when I give them, nutrition, I want to make sure that it's a solid formulation that's not going to cause them any problems.
Yeah, right.
Well, we're going to go ahead, Dr. Prasad.
No, if anything, some of the toxicity of potential toxicity of medication can be reduced without interfering their effectiveness.
Oh, true.
Yeah, and so we always say consult your doctor, and in some cases, you for example, in case of say diabetes, if your glucose level goes too down because of the micronutrient effect, then you go to your doctor, consult immediately. They may consider reducing the dose of the diabetic medication. And so, there is a lot of current treatment can be markedly improved in Alzheimer cases, in Parkinson cases, without interfering their potential efficacy. As a matter of fact, in case of Alzheimer's disease, you can improve for example, classical right now is a inhibitor of acetylcholinesterase inhibitor, which increases the acetylcholine level in neuron. But the neuron is dying because of increased oxidative stress and inflammation, and you are not addressing these things. So the effectiveness lasts only 3 months on average or 6 months. But if you combine this with micronutrient approach, then this will prevent the oxidation and inflammation. Neuron will stay alive for a longer time, and therefore effectiveness of your drug will last much longer. It's simple. I mean, if you know the biology, it is common sense, but nobody uses it.
No, they don't.
No one uses common sense.
No, it's not very common.
No, but the question is some of these doctors are not trained it. And if you tell him one-to-one basis, if I have a talk with a negative doctor who doesn't believe in micronutrient, I can tell you at least 25% I will convert them. Because I addressed to military scientists, as you know, when I was developing microdaily, they are the most conservative physicians. And I gave a 17 lecture to various arms of the army. And they were asking all kinds of nasty questions. But I provided scientific information, which is supported by clinical studies. And they all said, okay, you have some scientific basis for your formulation. Now you go test it. That's the way it started. But I'm trying to say that, if you have a negative and sometimes all of you, if somebody express some reservation, and if they don't want to talk to me, I will be glad to talk. And not necessarily that I will change their mind, but at least I can express my viewpoint.
Well, so if you would like to know, to hear Dr. Joe Schnider at Autism One, again, what day are you going to be lecturing at Autism One, the conference? What date?
September 3rd,
Yeah.
I believe 2:00.
September 3rd, 2:00. And again, the title of your lecture.
It's the functional neurological approach to developmental delays or autism.
Excellent.
Good.
So everyone, if you'd like to learn more about that, you can get his lecture. And then also you can find him at the Hope Brain Center. And I know, Dr. Kort, the hopebraincenter.com, but the name of your clinic is called the Hope Brain and Body Recovery Center. And
That's
so
good.
Beautifully named because you
name.
are hope, Dr.
Yeah.
Schnider.
Yeah.
And I just remember the struggles of him not being able to use his arm, use his legs, to be able to take care of himself, and now to run. I mean, that was his dream. And it's just such a privilege, isn't it?
It is.
Yeah.
We saw you last year at the conference, functional neurology conference, and I was just so pleased to see how you were walking. The fact that we were there for lectures all day long, and then into the night. And, your resilience, Joe, is amazing. And you are an inspiration to me.
Yes,
and
to everyone.
I say you're a hero to me because we just don't see people recover that way. No, let me put it this way. We have not seen people recover that way.
Hang on, yet, because you did it.
You did it. And now you're doing it over and over and over again in your clinics.
And yeah, exactly. And also helping people. I mean, that's the amazing.
I think we have time for one question. So we're going to go ahead. We've got a hand up. And normally we don't, but you want to be able to ask a question to Dr. Kedar and Dr. Schnider. So Ron Bush, if you want to go ahead and unmute yourself and you can ask your question.
Thank you. I didn't know if it would be against protocol, but while I've got Dr. Prasad here, I do have a question for him.
Mm-hmm.
Is it regarding stroke, Ron? Is it regarding our topic, or is it something that we can have you on Ask Dr. Prasad?
Okay, well, maybe I'd have to be on that because I've been diagnosed with lung cancer. And I heard him mention, cancers. And I've bought the micro daily
Hydro.
Yeah, hydro, and I've got the probiotic.
Mm-hmm.
I was told that I should do a therapeutic dose.
Right.
And so if it's okay, I'd like to ask Dr. Prasad.
Let's answer that question. Dr. Prasad, will you give the therapeutic dose for cancer?
I would say that therapeutic dose would be 3 in the morning and 3 in the evening.
3 sachets, or is it
3 a stick?
6, right? 6 a day.
9.
3, 6, 9.
9.
Isn't it 12 twice a day?
9 or 12.
That's
I mean, it will be. This will be okay too, and for short time, because the reason is because we have shown it in experimental system, and now many humans have tried it. The therapeutic dose of micro daily EMF, and we have shown in experimental system that high dose of antioxidants kills cancer cell, but not normal cell. And the reason they do it, because cancer cell requires glucose to generate energy because they're using a glycolysis pathway, not the oxidative phosphorylation. And so they need much more glucose than a normal cell needs it. And so high dose antioxidant prevents the uptake of glucose and glutamine. They need glutamine also to make all the important molecules in your body. And so without these 2 micronutrients, so what we are doing with high dose antioxidant, they're starving to death.
So
and it does not interfere.
3 in the morning and 3 in the evening?
Evening, yes.
Okay. And what about the probiotic?
Oh, yes, probiotic is a must once a day.
Just once a day?
Yeah.
Is it best to take that at night, Dr. Prasad?
Yeah, and actually, anytime night is okay, good. And the reason,
bless you all for.
So, and I like to know, I like to know also that after a month,
on your journey,
when you come next time, ask question or what testimonial, I too like to hear from you how your tumor is responding.
Thank you. God bless you all.
Thank you, Ron.
Thank you, Ron.
Okay.
You want to take Sylvia?
Yeah, we're going to go ahead and wrap up the call tonight. And I know that we actually have on the Wednesdays each month is Ask Dr. Prasad. And so
yes. Only thing I want to say that only time I recommend higher dose, therapeutic dose, is with respect to cancer.
With respect to cancer.
That's it.
Okay.
Okay. And you know what? You know what, Ron? Of course. And as a cancer thriver myself, I understand. And I'm so glad that we got your question.
And then after a month or 2 months, when your cancer gets treated, and if the doctor recommends, say, for example, radiation therapy or chemotherapy, You take
No, sir.
no, but I'm saying that because it will
I've been treated.
because it will enhance the effect of radiation and chemotherapeutic agent on cancer cell, but not on normal cell. This is another very important thing. So even if you take it, it will not hurt your normal cell. If anything, it will protect it.
Yes, sir. I have been treated, but I had stereo radio tactic surgery procedure. Okay. Thank you.
Okay.
You're welcome, Ron. And so we're going to wrap up tonight, Dr. Kort. You know what? It is an honor and a privilege to get to do these calls on the Optimal Longevity Series. And they're only going to get better because we have more and more stories coming that lives are changed. But Dr. Joe, your story is for anybody
amazing.
That have had a stroke, okay,
Thank you.
and they're suffering. There is hope. Okay, there is hope. And you got to just really hear from both Dr. Prasad, who really explained the mechanism of action of how we heal, and then to see Joe. And it's just an honor. And again, it's the Hope Brain and Body Center, and he'll be speaking at Autism One. And thank you again, Joe. You are.
And also I'd like to know how your patient with autism is responding. So in some time in future, when you have a time in a Zoom call like this, I'd like to know how they are responding.
Okay. Well, good record so we can get clinical cases in.
Yeah.
That sounds great.
Yeah.
That's great.
And really, as I have offered in many cases, that if there are 15 cases show a consistent benefit that you record it, I'm sure you are monitoring it quantitatively, and then one can publish it as a observation data. I mean, in a clinical journal, you see all the time.
Right. Yeah.
That sounds great. So I want to thank Dr. Prasad. Thank you, Dr. Prasad, for everything, all that you do. Dr. Schnider, I got teared up because I remember where you were. And for everybody on here, you know somebody that had a stroke, and they really can. There is hope for people.
Yes, that's it. I mean, that gave me extra strength, extra energy. Extra reason to live.
Awesome.
Yeah.
Thank you.
And so whoever invited you on this call, get back to them and say that you want to get started, and they can help you do that. And these calls on the Optimal Longevity Series, you can find them on YouTube under Team Serve. And so this one will be up in a day or so, a couple days, but just know all of the Optimal Longevity Series are there. Dr. Kort, why don't you close this out?
Well, I just feel honored and privileged to have three amazing juggernauts on this call, and myself. I'm blessed, Joanette, to have you as our lead scientist. You're brilliant, and I couldn't do it without you. Dr. Prasad, I'm so blessed to have your friendship and to be able to communicate with you. And Joe, I'm just so happy that you're still on the planet with us, because you are truly one of the most amazing healers I have ever known. A hero of mine, and thank you for being on this call tonight. It has meant the world to me.
Thank you.
I'd like to say thank you for being on the Optimal Longevity Series tonight.
And next week, Dr. Prasad's on vacation. We can't tell you where he's on vacation, but he's on vacation. However, we are going to still keep the call and actually share with the people some of the work we do on the cell danger response and the healing cycle. So if you want to be on next week, we're going to be actually doing some teaching. But then on the 25th of this month, mark your calendar, because it is going to be one of our best calls we've ever done. So with that, mark your calendars, and thank you, everybody. And thank you again, Dr. Prasad.
And if you've enjoyed this call, bring people to it next week. We're here every Tuesday night on the Optimal Longevity Series. We appreciate you all. Have a great night and be well.
Thank you.
Thank
Great.
you. Bye-bye.
Bye-bye.
Thank you.
Thanks, guys.
Thank you.
You can go ahead and unmute and thank Dr. Prasad if you'd like.
Really amazing. Thanks,
Thank
Dr.
you,
Joe.
Schneider.
Thank you.
Thanks, Dr. Prasad.
Thank
Thanks,
you.
Dr.
everyone.
Joe.
Thanks,
Thank
Dr.
you.
Prasad.
Thank you.
Thanks.
Wonderful
Thank you.
testimony.
Amazing.
Joanne.
Good night.
Good night,
Good
everyone.
night. Good night.
God bless all.
Love this call. Thank you.